Welcome to the deep dive. Today, we're taking a fascinating plunge into a topic that really touches all our lives, pharmacology.
It really does.
But we're not doing it in, a dry textbook kind of way. Oh, no.
It's definitely not.
We're exploring it through this unique, really efficient source, pharmacology. 100 essential exam questions and answers.
Mm-hmm.
Now, don't let the exam questions part fool you. This isn't just for students. Think of this deep dive as your personal shortcut to being genuinely well-informed about medication.
Yeah, understanding how they work, what they do.
Exactly. How they work, what they're used for, and honestly, some truly surprising facts. Our mission today is just to pull out the most important nuggets, focusing on common drugs you might see every day, helping you get this vital info quickly. Okay, let's unpack this.
And this source is, well, it's brilliant for that. The author is clearly a seasoned pharmacology teacher. You can tell they know what really matters, what needs to stick, especially, at crunch time. They've set it up for quick recall and active revision, which is exactly what we need to, well, learn smarter, not harder.
Smarter, not harder. I like that.
It's about getting that knowledge in efficiently. Avoiding that feeling of being swamped by information and really understanding these key concepts, not just memorizing.
Couldn't agree more. So let's imagine we're kind of navigating this rapid-fire quiz, but without the stress, right? We're here to guide you through the valuable stuff hidden in each question.
Sounds good.
Let's start with some of those drugs you might encounter regularly, maybe even have in your own cabinet. Paracetamol, for instance, household name. What's its basic job?
Well, paracetamol, or acetaminophen as it's known in some places, is your common go-to for, general pain relief and reducing fever.
Okay.
Its main action is thought to be right in the brain, where it kind of dials down the pain signals and helps regulate body temp. It's an everyday essential for a reason. Pretty effective stuff for common aches.
Right. And then there's aspirin. Most people probably think painkiller, maybe headache relief.
Mm-hmm. Common uses.
But our source highlights this irreversible COX inhibitor mechanism. Sounds technical, but it points to a totally different job, preventing platelet aggregation. What's that about?
That's a fantastic point. Aspirin does relieve pain and fever, yeah. But maybe its most important action, especially at lower doses, is as a blood thinner.
Okay.
That irreversible COX inhibitor bit. Think of it like aspirin permanently jamming a specific enzyme, COX, which helps make chemicals involved in pain and helps platelets stick together.
So it stops the stickiness.
Exactly. It doesn't just block it temporarily, it disables that enzyme for the entire life of that platelet. So those platelets just can't clump up anymore. That's why it's so crucial for preventing things like heart attacks and strokes. It's quite a remarkable drug, really. Dual purpose.
That really is powerful. And sticking with pain and inflammation, what about NSAIDs like ibuprofen? Non-steroidal anti-inflammatory drugs. Super common, but the source flags a big potential issue. Gastric ulcer risk with frequent use. Why?
Yeah, and what's fascinating here is how these drugs you can just buy, like ibuprofen, show a core pharmacology principle. Every action has a reaction, right? NSAIDs work by blocking those same COX enzymes we mentioned. That reduces inflammation and pain, great. But those enzymes also help protect your stomach lining. So if you use them a lot or at high doses, you can potentially wear down that protective layer. That can lead to irritation, sometimes even ulcers. It really highlights why you need to be mindful, even with over-the-counter meds.
It certainly does. Okay, moving to another common issue, especially this time of year, maybe allergies.
Yes. Hay fever season for some.
Exactly. The source mentions loratadine and cetirizine, used for allergic rhinitis and urticaria, that's hay fever and hives, but it specifically notes cetirizine often relieves symptoms without causing much drowsiness. How do they manage that?
That's a perfect example of how drugs evolve. Both are antihistamines, so they block histamine. That's the chemical causing the sneezing, itching, all that. But older antihistamines, they easily crossed into your brain, which is what made you sleepy.
Gotcha.
Newer ones, like cetirizine, are designed mostly to work outside the brain on what we call peripheral receptors. So they target the histamine causing your symptoms, but minimize that drowsy effect. Big improvement for daily life.
Definitely. Okay, here's where it gets, I think, really interesting: cardiovascular health.
The hard stuff.
Yeah, it's just incredible how precise these drugs can be in keeping that vital organ running. Let's talk atenolol. How does that help the heart?
Okay, atenolol is a beta blocker, specifically a selective beta-1 blocker. So imagine your heart has these little receiving stations, like antenna, called beta-1 receptors.
Okay.
Stress hormones like adrenaline latch onto these, making your heart beat faster and harder. Atenolol basically blocks those antennas.
Like a shield.
Exactly, like a field. It stops those hormones from connecting. The result, slower heart rate, lower blood pressure. It eases the heart's overall workload.
That's a great way to picture it. Then there's lisinopril, very common for hypertension and heart failure. But the source points out a common, often surprising side effect, that persistent dry cough.
Ah, the ACE inhibitor cough, yes.
You wouldn't immediately think cough from a blood pressure med. Why does that happen?
Well, if we connect this to the bigger picture, lisinopril is an ACE inhibitor. Very effective drugs. They relax blood vessels, lower pressure, help the heart.
Right.
But the cough isn't directly tied to the blood pressure part. It's a side effect involving other body chemicals. ACE inhibitors can boost levels of something called bradykinin in the lungs.
Bradykinin.
Yeah, and for some people, that bradykinin irritates the airways, leading to that specific dry cough. It's a classic example of how a drug's main job can have these unexpected but pretty common ripple effects, important for patients to know.
It really is. Now, blood clotting, another delicate balance, warfarin, well-known blood thinner. The source says it inhibits vitamin K epoxide reductase. Sounds complex. Can you break that down?
Sure can. So think of your body needing vitamin K to make several key clotting proteins. This enzyme, vitamin K epoxide reductase, is like a recycling center that recharges vitamin K so it can be used again and again to make those clotting factors.
Okay, like reusing it.
Exactly.
Yeah.
Warfarin comes along and basically shuts down that recycling center.
Ah.
By doing that, it limits the supply of reusable vitamin K, which slows down the production of new clotting proteins. Your blood gets thinner, less likely to clot. It takes a little while to work, so it's used for long-term prevention, like in atrial fibrillation.
Okay, so warfarin stops the making of clotting stuff, but what if you need to thin blood, like right now? That's where heparin comes in, using a totally different approach. It activates antithrombin III. How does boosting a natural protein work differently?
Speed. That's the key difference. Heparin works much, much faster.
Right.
Instead of stopping production, heparin basically supercharges a natural clotbuster protein you already have, called antithrombin III. When activated, this antithrombin III quickly neutralizes existing clotting factors. So it boosts your body's own anticoagulant system almost immediately.
So it's for emergencies.
Precisely. Vital in acute situations right after a heart attack, maybe during surgery where you need rapid anticoagulation. These two drugs, warfarin and heparin, really show how you can tackle the same problem, blood thinning, with different strategies for different needs.
That makes sense. Okay, shifting gears again. Let's look at how medicines fight invaders or manage long-term conditions. Amoxicillin, most of us have probably had that. A common penicillin antibiotic. It kills bacteria by stopping them building cell walls. Sounds fundamental.
It really is. That's the classic penicillin action. Imagine bacteria trying to build a strong wall around themselves. Amoxicillin messes up the construction process.
Okay.
Without a solid wall, the bacteria just can't hold themselves together, and they fall apart, basically. It's a tried and true antibacterial strategy.
And what about vancomycin? It also inhibits bacterial cell wall synthesis. But the source adds this detail, D-ala binding. Why mention that specific binding? Is that important?
Oh yeah, that D-ala binding is what makes vancomycin special. Often it's a drug used for really tough infections.
It's like a last resort.
Sometimes, yes. Think of it like vancomycin finding a very specific, crucial brick, the D-ala part in the bacterial wall structure, and stopping it from being put in place.
Ah, very precise attack.
Exactly. And that precision makes it effective against stubborn bacteria, like MRSA, methicillin-resistant, Staph aureus, where other antibiotics might not work anymore. It really shows the cleverness in drug design, finding ways around bacterial defenses.
It really does. Okay, chronic conditions, metformin, listed as the first-line treatment for type 2 diabetes mellitus. It improves the body's insulin use. How does it do that without actually being insulin?
Metformin's quite clever. It tackles type 2 diabetes in a few ways. Mostly, it tells your liver to produce less glucose, less sugar, and release less into your blood. It also makes your body's cells more sensitive to the insulin you do make, helping them take up glucose better. So it's not adding insulin, it's helping your own insulin work more efficiently. That's why it's often the starting point for managing type 2 diabetes.
Makes sense. And then, of course, there's insulin itself. For the management of diabetes mellitus, getting glucose into cells, for many, it's just critical daily.
Absolutely. Insulin acts like a key, unlocking cells so glucose can get in and be used for energy. For people with type 1 diabetes, their body makes little or no insulin, so taking insulin is essential for life.
Right.
And for some with type 2, as the disease progresses, their body might not make enough or use it well enough, so supplemental insulin becomes necessary. It really underscores how important adherence is for chronic conditions. Staying stable often depends on taking meds consistently.
So true. Now, as we dive deeper here, it's not just about what drugs do, but what else they can do, good and bad. Sometimes surprising things. Let's start with a quirky one. Metronidazole. Common side effect. Metallic taste.
Ah, yes, the metronidazole metallic taste.
Not dangerous, but definitely noticeable.
Definitely. It's an antibiotic for certain bacterial and parasitic infections. While that taste is just a weird, harmless side effect, it's a good reminder drugs can affect your senses in odd ways.
Then statins. Super common for cholesterol. But the source notes muscle pain as a common side effect. That can be a big deal for patients.
It really can. And what's fascinating here is how side effects like muscle pain or myalgia can seriously impact someone's quality of life and whether they stick with the treatment.
Right.
They can range from mild aches to, rarely, more severe issues. It's often a key reason people might stop taking statins. Really shows why that open chat between patients and doctors is so vital, figuring out if it's just a niggle or something more serious.
Absolutely. And then we get to some really serious potential issues. Clozapine, for instance, serious side effect. A granulocytosis, dangerously low white blood cells. That changes everything from monitoring.
Oh, definitely. Clozapine is an antipsychotic, often for treatment-resistant schizophrenia. Because of that very real risk of a granulocytosis, a huge drop in infection-fighting white cells. Patients must have regular blood tests, sometimes weekly.
Wow.
It's a prime example of a drug where the benefits, which can be life-changing for some, have to be carefully balanced against potentially deadly risks. Constant vigilance needed.
And this one, isotretinoin, for severe acne. Teratogenicity, meaning it must not be taken during pregnancy. That's non-negotiable.
This is one of the starkest warnings in pharmacology. Healthcare providers are incredibly strict about this. Isotretinoin is a known potent teratogen, meaning it can cause severe specific birth defects. There are mandatory strict pregnancy prevention programs for anyone who could potentially become pregnant while taking it. It just hammers home how profoundly some drugs can impact fetal development. Careful prescribing, patient education, absolutely critical.
Absolutely critical. Okay, let's switch gears slightly to some truly life-saving uses mentioned. Nlloxxone, for opioid overdose reversal. Quickly reverses effects of things like morphine or heroin. That's huge.
Naloxone is an opioid antagonist. Basically, imagine opioids sitting in specific chairs in the brain, causing the dangerous effects like slowed breathing. Naloxone comes in and literally kicks the opioids out of those chairs.
Wow, just boots them out.
Pretty much. It reverses the effects very quickly within minutes. It's a genuine lifesaver in an emergency, and making it more widely available has been crucial in tackling the opioid crisis.
Incredible. And finally, a surprising double-duty drug, Sildenafil. Most people know it for erectile dysfunction. But our source also lists pulmonary hypertension. How does one drug do two such different things?
It comes down to the basic mechanism. Sildenafil is a PDE5 inhibitor. Its main job is relaxing smooth muscles and blood vessels, which increases blood flow.
Okay.
So while everyone knows about the effect on blood flow, down there, that same mechanism works on the arteries in the lungs.
Same principle, different place?
Exactly. Relaxing those pulmonary arteries lowers the high blood pressure in the lungs.
Yeah.
So it's an effective treatment for pulmonary hypertension.
Yeah.
Great example of how understanding how a drug works can lead to unexpected uses.
That is fascinating. And last but definitely not least, folic acid. Crucial role. Prevention of neural tube defects in pregnancy. Supporting healthy fetal development. Huge public health impact.
Absolutely. Folic acid, it's a B vitamin, essential for healthy cell growth and division. Getting enough, especially before and during early pregnancy, dramatically cuts the risk of neural tube defects like spina bifida.
Wow.
It's a perfect example of how vital even simple nutritional supplements can be, truly life-saving in ensuring healthy development.
So after all that, what does this really mean for us? We've just done this pretty intense deep dive into pharmacology, using insights from what's basically an exam prep source. But you can hear it's actually a really powerful way to grasp some seriously complex information. By focusing on how these common drugs actually work, their different uses, those sometimes surprising side effects, you start to get the why behind treatments, not just the what.
That understanding is key.
Exactly.
Okay.
We really hope you feel more informed now, and honestly, kudos for engaging with this kind of focused learning.
Yeah, and this whole deep dive, it really connects back to something mentioned right in our source.
Yeah.
That bonus tip about reviewing 10 to 20 pharmacology test questions with answers daily, marking the tricky ones.
Right, the active recall idea.
Exactly. And this raises an important question, I think. Beyond just studying for a test, think about how that approach, breaking down a huge complex topic into these manageable connected facts, could fundamentally change how you learn and apply new knowledge.
Not just in medicine.
Not just in medicine, in any complex subject you want to really get your head around. How does that active recall, that bite-sized exploration, change your ability to understand and use information? What other deep dives could you take on using this very method to turn sheer information into actual usable understanding? Something to think about.